I think I'm here as a matter of conspiracy because I wasn't supposed to, and one of the panelists is my new boss, but I'm actually here as an example of resiliency. There were multiple lightning strikes that made this possible. We were introduced to Paul earlier today and got a feel for the range of topics that are under consideration. Our second panelist is Chris Baker. And so I've got a set of questions for you. And we will, if you would like to interject from the audience, this is a nice sized crowd. It should be pretty easy to do that. So we can go back and forth. All right, let's start with the question about detection. How do you, and please feel free to go at some length here because I'm personally very curious. What kind of detection methods do you think can distinguish between ransomware and some other kind of attack? What kind of false positives and false negatives do you have to worry about? What are the trade-offs there? What kind of time? Is there a difference between endpoints and, say, servers, or endpoint is kind of a general term too. You could distinguish between workstations and medical devices, whatever. So that whole range of things. How do you tell you have a ransomware attack? How widespread it is? And are there particular techniques that you think are better than others?
There.
Yeah.
Yes, there is.
Mhm.
Would you like to go first?
No, go ahead. You're
All right.
warmed up.
All right. How do we detect security incidents? I think there's a number of things at play here. From the angle of the question, it sounds like it's more from the technical perspective. How are you detecting and responding to offenses in the network? And for that, we have a number of capabilities, number of platforms that we use to provide those initial indications, context of which gets built so that we understand, are we truly looking at a security incident, or is this just a security event and nothing more than that? There's still the human element. And as I had mentioned in the keynote, I'm pretty proud of the fact that our team has gotten that down to about 4 minutes to triage activity to determine whether or not this is a security incident or not. They're using a form of artificial intelligence on a platform that we use to help them get down that low. But really, this is about making sure that you've got the right kind of information available to the folks that you want to actually look at the offense and determine whether or not a security event is a security incident. So there's an information curation function there and a fusion function there that has to be robust. You can't look at everything everywhere. You have to key into the things that are most important and develop context quickly so that you drop it on one side or the other. And just because it's dismissed doesn't mean it's dismissed forever. There may be something else that happens that brings that back around and gets reevaluated, and what was a security event is now a security incident. That's just from the technical detritus that may occur. But in a lot of cases, security incidents are identified by system administrators or somebody else that identifies an anomaly that's so egregious that our systems maybe didn't pick it up because we're missing some information, or it's something that our systems aren't designed to pick up in the first place. So it's not just looking at technical information to identify security incidents. It's also having the sense within the organization that if there's suspicion, start with security incident, and if we're wrong, we can always back off. If we're right, we can hopefully get in front of this thing, do containment, and get to a safe place quickly as possible.
All right, I'll add on to that. Can you hear me in the back? If you can't, there's the seats over here. So I went a little bit more simple with what I think is the answer to your question. How would we detect it? I think in a lot of cases, how we detect it is a call to the help desk from someone whose files got rendered into a state that they can't open with Microsoft Word, for example. It could be a sysadmin, like you said, Paul, someone who's digging around on the system. The ones that would probably concern me the most are the ones that happened 30 days ago, 60 days ago. Because I don't know about you, but backups sometimes are rotated through 4 weeks.
Right.
And then after day 29, you lose the ability to restore that. So I have seen that in the past. But if it wasn't important enough for someone to notice until 29 days, there's an argument there. But I think, you in practicality, I expect to learn about ransomware from lots of different angles. It's not going to be the EDR tool all the time. It's probably going to be more like someone emailing the CIO saying, hey, this weird thing is happening, and me getting a call or something from her. Or worst case, I don't know if this happened, but the FBI calls and says, we've got evidence here in one of our busts that you may have been compromised by ransomware, et
Yeah,
cetera.
I've had a few of those.
Yeah.
Yep.
So I think the detection can come from anywhere. You hope it comes from the EDR when they're detonating the package that's starting to encrypt and worming around the network. But because then you can catch it quickly in
Right.
4 minutes. I'm envious of your 4 minutes. I want to know more about that. But yeah, how we're going to learn about it could be from anywhere. Karl, there was a lot more to your question, though. Did we get to all of the pieces?
I know a few years back, I had a crash of desktops that showed up literally in the hallway because nobody could use them. They had been hit. So there's one example of, are you prepared to, and it was, I would say within a week or so, about 30 of them showed up. What kind of preparation do you have in place for, in that case, the remediation was to yank the desktop, take it away from them, and give them. How much, and that's an example of resiliency you were talking about this morning. How many, too concrete here, but how do you go about evaluating how many desktops do we need laying around doing nothing for some period of time, just in case? How do you go about it? And I don't want a specific number for this hallway, that hallway, but how do you make that decision?
I think this is a matter of fleet management. So at any one time, you want to be replacing a portion of your fleet anyway. That's the ideal state. I know a lot of us, including my organization, struggles with that, but that's the ideal state. So if we can get to that state where we're replacing machines anyway, and there's a stock to do that, well, there's a ready stock to draw from if we have to redirect and address a crisis. It at least gets us started. It might get us through, depending on the impact, but at least it gets us started, gives us something to work with. In terms of keeping a warehouse full of machines, nobody really wants to do that. You can't deploy those machines fast enough to be meaningfully used. You're wasting money. So the idea that you're going to have hundreds or thousands of machines standing by is just not feasible. On the flip side of that, if we get into crisis, because if everybody remembers July 19th last year, if you get into a crisis where you're going to have to change machines out, setting up a robust rotation process where you're collecting machines, re-imaging those machines and getting them ready to go back out the door at the same, you essentially have assembly line going. So you're running through the environment, picking up machines and deploying machines. You just need enough to get started. But you're pushing machines out as other people are collecting machines, bringing them back to be re-imaged. That's essentially what we did. We worked our way through that particular crisis.
Now you're necessarily disrupting your organization,
Yes.
and you pick up the lag 30 days later, 6 months later,
Yes.
play it by ear.
Yes. At some point, you've got to get back to normal, and you got to map from where you're at in the crisis to back to normal. And how do you get to that point? Because you deplete your entire stock on your initial swing, and now you're running through the rest of pulling machines back, rotating them back out. At some point, you have to rebuild your stock to get back to normal.
Right.
So again, this is more like fleet management than anything else. But that's an approach.
Yeah, there's never going to be enough machines to replace a large scale event like that. I guess it's, business decision, do we prepare for that by buying more machines? But then you just have more sitting on the shelf ready to go. Instead, maybe focus on the process to rebuild, have that image ready to go and an assembly line ready to go. That way, I think you could limit the capital spend on new hardware and still fulfill the need of the organization. And then maybe you get to a point where, you triage which machines do we need to replace first. And I might even go one step further. In fact, after, I assume July 19th was a CrowdStrike incident.
It was indeed, yes.
July last year. Yeah, I was with a company, a hospital system that used a different EDR tool. So I just sat there and watched from the sidelines and chipped in on Signal. Hey, good job, guys, to my friends who did it. But it's that caused us. It was Microsoft Defender actually that we were using, and that caused us to take a look at what was happening with CrowdStrike and devise a strategy where we could isolate critical machines with a magic button, a halt button, and protect those from, it would isolate them from anything, but it would protect those from getting an update, in this case, a malicious update or an update that caused problems, but at least protect the state that it's in. So I think there's ways to prepare for that don't require going out and buying a bunch of hardware. Just depends on what the organization wants to bite off.
To kind of expand on that, thinking a little differently about the fleet. So we're talking about the fleet as if it needs to be physical devices, and there's some physicality there. You could have something on the nursing station. But the what is, I think, up for debate. Does it need to be a full, robust desktop, or do we need to have a desktop running someplace else like AVD, Army Azure Virtual Desktop, right? And that's where the main compute happens. You just need a pathway to get to it. That makes doing something at the physical location a lot easier. You just dump in reimage. In fact, you can probably make that read-only. We're kind of swinging back to thin clients, if you remember the thin client days, right?
Yeah.
So there's some mix of that might make sense for that resiliency play.
So if your organization didn't already use AVD, for example, is the middle of a ransomware incident the time to start figuring out how to implement it?
Oh, absolutely not.
Yeah.
Absolutely not. At that point, you got to go with what you've got. Park that for consideration later, because in the middle of a crisis, you've got to get through the crisis. Got to get back to normal.
So I got dragged into that July, me and some security analyst people, a bunch of people who I'm not a PC tech, I have no pretense to it, but the next thing you know, I'm on the pediatrics floor, sticking a USB in desktops. Now, the people were really I was pretty impressed with people on the floor, clinical people, could relatively quickly say, these are the high priority, we'll wait on them. How much, and of course there's a pattern here, that you can have 2 of everything, but that's clearly a waste. Right? So there's something in between having 0 duplicates. And so how much of that advanced tagging machines by priority can happen on the fly, and how much of it is so sensitive that it really needs to happen in advance? And is there a way of deciding, is it reasonable to say, okay, we're just saying everything in OR is category 1? This has to go with qualitatively, what kind of things do you think about during that preparation for the event?
The best time to do planning is before the crisis, right? We have to make time for that planning, and that's the thing that usually doesn't happen.
Because that costs money too, right?
Well, and effort and focus. But do you do it on the fly, or do you do it all ahead of time? I think it's actually a mix. There are some workstations we know are absolutely critical. Those that are in the OR, those are a few that are at some nursing stations and some other critical devices. Even within System Office, there will be some that are particularly important. Those should be known ahead of time, at the very least, tagged on the fleet, so that if something bad happens, you can address those first. When you start to spider out into the units and the offices, certainly getting input from the office staff is critical, because they are the ones that will know best. Please tell me, of the 50%, give me your 50% here. Which ones do you need right away? Which ones can we come back for? But there's also a dialogue that needs to happen. The office manager needs to know, well, when are you coming back? Is it this week? Is it next week? Is it next month? When will that be?
We usually have some sort of bridge going on where the leaders in each of those areas are communicating real time back with the mothership, the command center, if you will. And as far as the PCs go, we've got these downtime PCs people, know about. I think I've seen they're either red keyboards or somehow indicated, and the floors all know what these are. What we learned in a recent incident, more recent than the one Karl was talking about, was that people don't regularly exercise them always. At the place I used to be, floors, wings, boards were asked to have someone sit down at that PC and work on it for one full shift every week. So that there was someone on every shift who had been recently working on that. But in a case where things have really gotten out of control and now you've had to limit network access, those things will work as standalone PCs and they'll be able to get you what you need to provide, critical care in many instances. But, if you want to look at an image or, a study of a, barium in the heart sort of a thing, are you going to be able to reach that when you've shut the network down or you've isolated the PC? So those are things, like you said, plan that. Make sure that you know what the process is before the crisis. Yeah. And Change Healthcare really kind of opened my eyes, because even though that was a cybersecurity incident, it wasn't our cybersecurity incident, right?
Right.
And then CrowdStrike comes along and, that wasn't really a cybersecurity incident at all. And what they're all pointing to, and there's probably lots of others, but they're all pointing to these single points of failure. And are you prepared for when these sorts of things happen? And with change, none of us were prepared. I know all those prescriptions and all that data going through one company. I know a company, a health system, that had to take out a loan due to change because they didn't have enough money to pay the bills. And so they're fighting a crisis, and they're going to the bank saying, hey, can we have money so that we can continue to do our operations? So you can bet that mistake's not going to happen again. But where else is there a single point of failure? And so trying to eliminate those when it comes to ransomware, you are going to want to take extreme measures. Can you continue operations with extreme measures in place? What impact is that going to have? Know those things in advance. Do ransomware simulations. Talk it through tabletops, readiness assessment. Make sure you're prepared for when that happens.
All right, let's zoom out quite a bit. You hinted at this in your presentation earlier, that there's a variety of ways, one way or another, if you're in the middle of some kind of extortion attack, ransomware, for example, somebody in the media gets wind of it. How do you respond to media inquiries? And how much time do you have? I mean, do you try to get ahead of it? Do you wait? All of it.
I think, so once a security incident is declared, a number of things begin to happen. And among those, our communications team, we have an entire enterprise level communications team. That communications team activates just as they would for violence at one of the hospitals or in the region, or a natural disaster or any other kind of situation. When we stand up our crisis response, part of that is the communications team is also standing up, providing advice to senior executives on what should be said, when it should be said, where it should be said. Our legal counsel is engaged as well. Typically, in a security incident, we're going to have external legal counsel engaged as well. What we share with our team members is to refer those matters to communications. We make that generally available so that people understand what that path looks like, right? So that we can at least, in as much as we can, foster good communications about what's going on to the appropriate parties. Now, there will be, at some point, somebody posting something on Facebook or something else, and that will cause a reaction. We have to react to that. But by and large, we want to try to make sure that our communications team is engaged early in the process and can help articulate what needs to be articulated to the general public, to our patients, to our team members. That's our approach.
Yeah, patients, that's an interesting twist. So presumably, at least some of them are in the bed.
Yes,
And
the team members are giving care to those patients. Yes.
I think back when I was in college, I took a class from back then, advisor to the state of Michigan governor. He was an environmental guy. I was taking an environmental class. And he talked about all of the debacles and problems from not disclosing a environmental disaster. You know, and the message there was, and I still live this, is communicate early, send a message, be transparent. You may not be able to be fully transparent. You may not be able to say, it was this variant of ransomware. It was this, we believe it was this nation state that attacked us, that sort of thing. But getting the message out right away that something has happened and we're dealing with it. And we probably can't go into detail right now, one, because we don't have the details, or two, because that information getting out might be an advantage to whoever brought this down on us. So, you know, trust us, we're working on it. And if you have any concerns, please raise them. So, you know, communicate early, and always say, you know, we'll be back to you in 2 hours with an update, and then hold to that 2 hours, right?
Mm-hmm.
Yeah, but I think, you know, communicate as much as you can about what you're doing. The first thing that when we convene the command center, I'm going to ask for is, you know, is any of this attorney-client privilege? Is any of this something that we cannot disclose? And maybe not so much for a ransomware, but for other cyber attacks. It might be that we want to keep some of this private, even you know, even if there's litigation. But normally that's not going to be a concern. And if it is, the lawyers will drive the discussion. If not, the comms people probably will drive the communication.
speaking of lawyers, is there been a discussion in advance, or should it not happen in advance? Should it happen later? What the legal consequences of paying or not paying the ransom is?
It has happened in advance. We do talk about this. We actually talk about this quite often. That's not a decision I think you can make before you're in the crisis. You can certainly have a good idea of where you're going to land on this and why. But I think once you're in the crisis, understanding what's going on, understanding what criteria you're going to be making decisions by, and who's going to help advise on that is important. And those are the conversations that need to happen first before you get into a crisis. Once you're in a crisis, you're way behind. If you haven't done any of that, you're way behind the 8 ball, and you're scrambling. Stress will be very high. But do you pay? Do you not pay? Well, there are a lot of factors that are going to go into that decision, not least of which is whether or not the threat actor may be at this time or maybe at some future time on the OFAC list, Office of Foreign Asset Control. And for those of you that don't know, it is a felony in the United States to be paying a ransom to a foreigner who is on the Foreign Asset Control list, even if it meant getting your system back to serve your patients. It's still a felony. You cannot share that, and you cannot pay that ransom without getting a special license from OFAC, which you can do. But these are the things you have to talk about up front with your internal general counsel and with whoever's going to be representing you for external counsel to make sure that all of those things are tied together. And let's not forget the insurance underwriters as well, because they have a stake in that as well. So certainly having those conversations ahead of time, understanding who's going to get what calls when, that's the important part of planning and preparation.
Yeah, and then, go ahead.
Would it make a difference about whether is there a difference in response based on whether that hospital is a for-profit or not? What I mean by that is for profit about money coming out for hospital.
Well, my take is less for-profit, nonprofit. My take is probably more government-run versus non-government run. You know, you don't want to pay a big ransom regardless, but it's usually going to be the insurance company who pays the ransom, right? And in fact, we're not going to have a bunch of Bitcoin sitting around to pay a ransom. So that's why we buy insurance. But I honestly don't know unless you have a thought on profit versus nonprofit.
I think the stakeholders are different. The questions are still the same question. You still need to have an established set of criteria. You need to understand who all the stakeholders are that need to be part of that decision making. And that should be done ahead of time. Because if it's not done ahead of time and you're doing it in the crisis, chances are pretty good you're going to leave a stakeholder party out of the process. And that's going to create problems later.
So I was going to add to that. I used to work for, up until 6 months ago, I worked for a company in Philadelphia, health system in Philly that bought Lehigh Valley Health Network or merged with Lehigh Valley. And if you were watching the news, Lehigh Valley got hit with a pretty big ransomware attack in 2022. Maybe it was Feb 2023. But data for 600 patients was stolen. They included images of unclothed people, most of whom were seeking treatment for breast cancer. And there was a ransom demand of, according to the news, $6 million. That's outrageous, right? The case was settled in October for $64 million. Class action brought by the patients. And the claim was you had the ability to pay the ransom and avoid our embarrassment. And there was a discussion about, can we even pay these ransomware villains? And the CEO went public very early, as from what I'm told, with we don't pay ransomware demands. But that gives you an idea of the magnitude that we're talking about. Now, I've read that that's the largest settlement and ransom
I believe you're right.
combination that's ever been levied, but I'm expecting that to grow now that that's public. So, you know, $6 million in the hands of a ransomware crime group is a lot of, you know, that's could be a year or multiple years' salary for the group. So I don't want to fund that with that. So, you know, when it comes, for me, there's two reasons you'd pay a ransom. One is get access to your data, and if you got good backups, which you should now, that's it. In this day and age, you need to have that covered. You're not doing it to get your data back. You're doing it to prevent the docs. And that's what we saw in Lehigh Valley. And you can see very easily how quickly it can go south. $64 million. And for 600 people, you do the math. Lawyers probably took half of that. But then, I don't know that if I was in that position, any amount of money would offset.
No, it's $64 million that will not go to treating patients, first of all. Was it preventable? Gosh, that's really hard to say. This is why I say negotiating the ransomware is a decision that has to be made during the crisis. You may have strong feelings. I have strong feelings about paying ransom. And yes, there are consequences. Yes, you are feeding into the resources available to criminals to continue doing what they do. It's already a billion-dollar business. Adding $6 million to that isn't necessarily going to make or break that, first of all. The other side of that coin is that developing partnerships with federal agencies is critically, footstop here, extremely important. Because if you are in that situation, you're not alone. You have partners that can help you with that. The FBI has successfully recovered funds, Bitcoin funds, recovered those funds in certain cases. And where that has happened because there was a partnership early on. So if you do have to pay a ransom, you could pay the ransom, but send a little extra, right? And then in the case record later, as things are prosecuted, you could recover some of those funds. Now, it won't be as much as what you put in, because Bitcoin goes up and down like crazy. But those are some of the things you have to talk about during the crisis. Is this the time that we pay the ransom because we're expecting a certain outcome? We want to influence the threat actors a certain way. We already know the criminals are going to do whatever they want. So if they already have it in their mind that they're going to take the money and run and publish pictures and do all kinds of badness, you're not going to stop them from doing that. If you were to, in this case, pay the ransom with the hopes that it wouldn't get revealed, and it later gets revealed, well, you did what you reasonably thought was appropriate. Can you be faulted for that? I don't know. But on the flip side of that, not paying it turn into probably a class action lawsuit and will cost a lot more money to litigate.
Yeah, I don't think there was a right answer in this case.
Generally, there isn't.
You can, dig in your heels and not pay, or you can pay and hope they, criminals aren't known for being, people of their word, probably, but, they could always take the payment and follow through anyway. So, yeah, it's a difficult position. I think it's important to have the discussion in advance. Ask the leaders in the organization, what would we do if this happened? This is an ethical challenge in a lot of cases, and so I don't think there is a right answer. You hope for the best, and in this case, it didn't work out well for either the health system or the or it turns out the attacker. Lots of damage was done for no reason. And what a despicable kind of thing to do, not just attack healthcare, but attack cancer patients. That's just terrible.
Now, the terms of the cyber insurance itself is going to tie your hands in some way.
That may or may not be the case, but this is why having the conversation with your insurance underwriters, your insurance brokers, not just up front, but during the crisis, and then even following up after the crisis. Transparency here is particularly important. We've been painfully transparent with our insurance underwriters to make sure they understood the extent of our program. We have concerns about where information is stored and who's holding that information, which we express to our insurance underwriters, because insurance underwriters are, send us all your stuff and we'll look at it. Well, no, we're not going to do it that way. We will invite you in. We will open the kimono. You can look at everything you want to look at. You're not taking anything with you, which we did. We were very transparent. And in terms of how we do our decisioning, how we would do our decisioning in a ransomware situation, in a crisis. We made it pretty clear that we would be relying on them for assistance in this space. They've dealt with many of these so far. We would expect that help from them. That's part of the reason that we're doing the engagement in the first place.
So we keep saying have that discussion in advance, but I've had that discussion in advance. And if there's no cyber incidents going on, there's usually, well, we'll deal with it next year, right, or next month, or whatever, right?
Yeah.
And so you've got to get their attention somehow.
Yes.
And that's why you
Yes.
familiarize yourself with the details of the Lehigh Valley incident or
Yeah.
the Ascension incident or what's going on now with Oracle, right? You got to look at what's happening there, and then you've got to bring that in a way that's digestible and that hits home, right? I can tell my leaders, all the details about something, and their eyes might gloss over. But if I say, if that were to happen to us, which is a very real possibility, Epic is not going to be reachable for weeks.
Yep.
Everyone perks up, so and I wouldn't use that card and I wouldn't just come into every meeting and say, Epic's going to be down for weeks, guys, if we don't do this, if we don't approve my timesheet.
Carl needs a raise.
I see Nicole's here, so I threw that. Yeah, but when it comes to, this is really important, we need a strategic direction here that involves a significant investment. That's where I'm going to pull that.
Absolutely, you're spot on. And when we get into situations where, it's not us, we don't have to worry about anything. No, that's still a talking point. I generally don't let those go. That's still a talking point, at least within our IT senior leaders circle, to understand where we're at, and probably a little bit broader than that. Look, this is what happened. This is what they're facing. These are decisions they've got to make. Would we be ready to make those same decisions? How comfortable are we with the state of affairs? Forget that it's, in this case, it's Oracle Healthcare. Forget that it's that product. What if it was Epic? Would we be ready to have those conversations? Because if the answer is no, we're late. We need to have those conversations. And not next year. We're going to schedule the meeting now. We're going to have that meeting. We're going to talk through these things before we let before we let the incident fade into history.
Tell you what, I have 30 more questions, but we have 10 minutes, and I think that the audience has questions right there. I bet you do. You were first.
No one raised their hand.
Guys, or are they insistent on worse or processing and stuff?
I can say personally, their questionnaires have gotten longer.
Yes.
I don't know about demands, but
Yeah, the questionnaires have gotten longer. The expectations have gotten more prescriptive, but in a way where generally that's where I go open kimono and say, look, we got to sit down and talk about this because what you're asking for isn't actually hitting the mark. Let's talk about what I think hits the mark. You should be using X, Y, Z or ABC, something or other. Okay, but you don't know my environment. You don't know what's going on here. Let's have that conversation about why you think I should be doing this versus what we're doing. So yes, more questions for sure, and a little bit more prescriptive on expectations. So I've had to have that conversation, talk about, well, let's just talk about where we need to actually land for you to have assurances that we're doing the right thing.
we can say DLP because we got proof point and a simile here.
There you go.
But that's a good one. You guys need to implement DLP or you need to change your implementation of DLP, right? And do you know our environment? Do you know how that will either succeed or not succeed?
Yes.
Yeah. Back there, 2 questions.
Within the health system, Do you have programs in place where you're educating not only your clinical staff, but then also the literacy of your patients, since they come in and out of you?
Oh, I love that question. Yes. Turn on two-step verification, please, if you're a patient. Yes, we've talked about this. We have done some cyber education. We're careful about what we do in that space, but I'm certainly all for it. I think that's, for us, that's part of the holistic experience, right? But I also recognize that we can really flood that channel with a lot of information, and it just becomes another, bulletin board or poster or whatever, and people just start ignoring it. So what we share, how we share it, I think has to be impactful, and not just like this constant drone of be cyber safe, be cyber secure. Great question. Thoughts?
Yeah, I just wanted to add, so I'm an Epic, my system is an Epic customer, but I'm also a user of Epic MyChart. And I learned at the Epic conference last year that two-factor authentication is enabled on MyChart. The organization has to turn it on. And I don't know about Cerner, Oracle Health. I don't know about how you interact there, but what I learned is, I think it was later last year or maybe earlier this year, Epic was going to, when you do an upgrade, was going to turn that on by default. Now you as a health system could disable it. And I'm just curious here if anyone has MyChart. Maybe you don't want to raise your hand, but does anyone have MyChart with two-factor enabled? Okay, so we have 2, 3 yeses, 4
Yes.
That's really good. Hopefully you're with a good health system that has turned that on and said, yes, we want to do that. Fingers crossed it's UVA. But anyway, yeah, that's something that you see how slow the adoption of security is. We don't want to upset people by turning it on, and then eventually, I think here we may come to a point where you can't use MyChart if it's not on, which I'm secretly hoping for comes soon.
Let me just add, we pay for a lot of intelligence, curated intelligence, and we do some collections off of dark web, deep web. The number of patient record portal credentials that have been collected and are being peddled is enormous. It's enormous. We screen through that weekly up until we turned on two-factor. I was jumping up and down in the organization. We got to do something about this. This is really bad. Folks don't even know. It's not our fault, first of all. Folks don't realize that on their own machines, in their own home, they've got a credential scraper, and probably more than their patient portal credentials have been stolen. They don't know that. They don't, because they're not looking at the information, but we see it. We at least can say, yep, two-step verification is required. That will at least slow down an attack, if not halt it altogether. That coupled with what people do with their banking accounts with two-step verification or multi-factor authentication should provide a sufficient level of protection, not entirely bulletproof. But for those organizations that are still waffling on the do we turn it on or not, I think the answer is you're a little late to the game on that one. Question over here first, and then.
Maybe I don't know if it's the first one on when people call it campaign. When we talk about access to patient records, I have my mother very much on volume from last year. There was an access code for her. I will call her, give me the code, so I can access every single building on my end. And then code is for credentialing for whoever is breaching my internet or whatever, if you're getting access to the internet, who that fall?
So fault and liability, that's a tricky question. If the system is working as intended and the threat actor has found a way to subvert that, we have a problem in design and application. I'm not sure exactly where fault lies, but it's certainly something that needs to be addressed. What typically ends up happening in situations like that is the attacker is able to get into the channel to either scrape the credentials and use them independently or persist in channel. We see this with SMS phishing attacks. Persist in the channel so that when they see that there's an access happening, they can intercept and gain access themselves. That's a subversion usually at the endpoint, which is usually under the control of the individual, the patient, the user, right? Those are really hard to defend against. Even for systems that offer their services, it's still very hard to defend against. I know that's not a complete answer, but that's. Yeah, I will tell you for a very long time, and it's changed recently, I've maybe become a little bit more trusting, but for a very long time, I would not do remote banking except through a separate VDI instance that was off and on a separate hard drive, not connected to my machine until I did my banking. Right? I mean, that's how freaked out I was about those credentials, particularly because the bank I happened to be doing business with didn't really understand security either. So that was really, it really freaked me out. But the endpoint is still a potential target, which is why additional things like multi-factor authentication, two-step verification are really still necessary. So you couple that with maybe Face ID, so you're kind of layering defenses. What that does is it raises the bar for the attack. It makes it a lot harder for somebody to actually get the information, any meaningful information, and do something with it. And that's ultimately what we're trying to do. Can we actually stop an attack? Not really. If somebody really wanted my information, if they applied enough effort and have enough time, they're going to get it. My best shot at defense is to make this as long and as hard and as difficult as possible for them so they give up. And that's really the name of the game, is putting enough controls in front so that somebody who isn't supposed to be in that channel gives up.
That share full access to
In what sense?
Atlanta, and if I go into my chart, I can also access my key client, patient record in Emory.
Right. But those are, it's one application though. So you're actually using one application that is connecting to two different backends. You can, but you need creds in order to get to any of it, right? So you're aggregating on your device only what's transferred to your device. I've had to go deep down this rabbit hole. You're connecting to the three portals independently using the same application, if that makes any sense. And so each individually, and Epic has designed it this way. And I don't know about Cerner or Oracle Health, but it purposefully transfers only the information you need to see at the time. And it compartmentalizes it. So yes, you've got all three of those on your device. And for me, I have Face ID to be able to get into mine and my mother's. But that information is not commingled except that I'm looking at it on the same device. If that makes any sense. If that identifier has been granted access, that's the trick, right? So with my mom's MyChart, for example, I logged in with her credentials. So I log in with my credentials to my MyChart. So I don't know the details. I'm not an Epic MyChart expert, but if your mother granted your account access to her data, now you're right. You've got one account with two things, two connections it can make, and there's a potential issue there.
So there was a couple questions.
So, so there's another health system. Okay, that's really important. They haven't turned on MFA, and for the reason I don't. We've had it on since it was available with Epic. And I do know we have patients that visit both health systems. I've bumped into people before and they're like, why does my name the other? Why aren't they protecting my information with them as well as Riverside Health? You know, you do what my bank does. So I think that's important. I'm glad to hear that he's going to make that call. Shame on any of the health systems to turn that off. That's, I mean, come on. Secondly, I get the same dumps that you do, Paul, where you're going to see your patient spreads out on the dark web being sold. Do you do anything with it? Do you do any outreach to those patients and say, hey, because we have, and sometimes that's a quick conversation, and other times it's like,
It's a rabbit hole.
it's
Yeah,
Never seen it.
and it becomes sticky, right? Because that person is convinced you did something wrong, right? And it's hard to address that. So we've gone back and,
get into their record and call some sort of
Yeah.
hack this patient's records. And we have to reach out to them. But it is.
yeah, we've done reach outs where we feel it's particularly egregious, like keep showing up, right? But what we have done is like roll the password, force a password change, right?
You tell them that you did that, or do they discover it
It
next time?
depends, and this is the part we're a little bit on the fence on. I'm on the side of yes every time. There is a downside that I just simply have to respect that position. That could become a problem in certain cases. So we haven't fully cracked that nut. I'll be totally transparent there. We haven't cracked that nut.
We have seen repeat ones, and we're like, you know,
Yeah. Yeah.
The ones that are these ones
The same.
are on their way.
We have the same approach. We have the same approach. So we don't, for the ones that are egregious, we certainly do that reach out because there could be something else. Especially if it's persistent and it keeps happening, right? Something clearly is wrong.
Whoever's supposed to can't log in or don't knowledge of or the possession of these types of things. Like, well, I can't educate people on that, so I'm not even going to enable that.
Yeah, that's exactly, thanks for bringing that up. I wanted to raise that a little bit earlier, but thanks for bringing that up, Mike. That's exactly the counter argument. We want maximal access and maximal utilization of the patient portal. Anything we put in front of that would inhibit that, slow that down, or cause a person to say, that's too hard, I'm not doing it, is a serious consideration because we still want that maximal use. We internally argued about this for a long time about, well, do we turn this on? Does this cause this kind of friction? What are we going to do about this? We finally came to the conclusion that, yep, we're going to need to turn this on. It's going to create some frictions. Somebody might come back at us and say, you're blocking access to healthcare records and shame on you and we're going to sue you. That has not happened yet, thank goodness. Doesn't mean that somebody won't think of that and try it, right? So those are some of the things that we really have to consider. I still think it's a smart move. I think it's the right way to go.
I'm trying to
Turn
think
it
of
on.
something that doesn't create friction,
Right.
you know?
Right,
Exactly. I had a
You don't have to use it
right,
at first, encourage it.
right.
It's easier for people to do, but, you know, when we enabled MFA or two-factor authentication, I don't remember it being
It ultimately turned out to be not bad for us either, because there was that concern that as soon as we turn this on, the sky's going to fall and people are going to be really upset. We turn it on, there was nothing, not a single phone call.
Yep. All right, can we take, how many more? One more?
I'm gonna put it on my phone, I'm gonna use it, so they're already in the know of technology. So I think
You're right, and this is part of something I kind of touched on in the keynote, and this is where the society gets to a point where two-factor, of course, we do things this way all the time, this is how it's done, versus, ooh, the telephone is new, I don't think I can turn the dial thingy, that might hurt my fingers, right? I mean, it is a generational thing, and I think as we progress, society is going to get more comfortable with the controls that need to be in place for us to be safe on the internet.
Well, I agree with you, but today I got an email from an 87-year-old friend of mine. We're in the same groups.io. And I think groups.io and 87-year-old, you know, that's a stretch right there. But what he did is he emailed the group the hack to update your old Windows 10 machine to Windows 11. I'm like, this guy is brilliant. 87 years old, sending me the hack. And I thought that was fantastic. So he's not gonna be a problem adopting Face ID with
No.
his My Chart, right? But now my mother, that's another story.
Was it that time already?
Yes, pretzels.
Holy cow.
Just your relationship within the C-suite, particularly with CIO. The purview that you all have within your position change years and throughout your careers, and particularly with the ransomware, all of a sudden, perhaps you listen a bit more. Security folks saying that they will discuss with CIO, for example.
Sure.
You want me to take that first? So I realize that the CIO's first question is the system up, right? Is it efficient? Are we, efficiently spending money? And my first question as CIO, you probably agree, is what's the risk of doing that,
Ditto.
right? So if there comes a point where we don't agree, because I report to a CIO, it's probably going to be the cost equation that wins, not the risk equation. And I'm as pragmatic as you get, I think, when it comes to cost versus risk and security versus inconvenience and that. But, there are times, I think, when a CISO will bump up against that and struggle. I realize that, but I'm going to do the best job I can. I'm going to get as secure as I can. And if I can't make the cost equation work, then maybe there has to be another alternative. And, fortunately, I work for a CIO who gets it and kind of respects the complexity of information security and knows that, she's not an expert. I am an expert. I've got a bunch of experts who work with me and for me. And so she trusts us that we're going to advise the right path.
Yeah, very similar experience. I mean, gosh, I think about the number of bosses I've worked for over the last 4 decades. Lots of different leadership styles. The most important thing, and just about everybody in the room can identify with this, is that subordinate to superior relationship and establishing a good rapport and a good relationship. It doesn't mean that you always agree. And doesn't mean that the boss is always right and we'll just do what the boss says. I've been very fortunate to have leadership that listens. Sometimes it's been a challenge and it just depends on the nature of the environment. Perhaps some of the historical context prior to when I got there might be relevant. I have to work through some of those challenges. But by and large, I don't set the risk tolerance level for the organization. I report on it, I pay attention to it, I identify risk gaps and risk concerns. But the decisions our leadership makes defines the risk tolerance for the organization. In order to do that effectively, they need good, sound advice. And that's our job, is to provide that advice. We speak in terms of risk. The decision gets made, we document what we've done, and then we move on. It may turn out to be a bad decision later, or maybe it's a good decision. We'll know for posterity's sake what we did because we should have documented, right? But ultimately, I've not been, in recent years, not been in a single conversation or argument where I felt like this is it, you either need to do this or I'm out of here. In just about even the the epic two-factor conversation is probably the toughest one to have because there were pros and cons to both sides. I could see it. Didn't mean I ascribed to that, but I could see it and understand it. I still felt the risk was something that could not just be brushed away. And we get into those situations occasionally where it's like, look, I feel like you're not understanding the risk. Now, if I hear from my boss or from other senior leaders, no, I heard you. I hear what you're saying. I'm going to do this. All right, then decision is made. And we'll see where that leads us. Did that answer your question? We got time for more?
Analysis associated with cyber incidents that other folks have dealt with. Now, one of the things that can happen to you, you don't necessarily want everybody to know. You don't necessarily want everybody to know what you went through. There's some teams, Fred, a few others, right, that did become public. There are a lot that don't become public. But is there a forum that or that some people can participate on to really learn those lessons, like, that can improve kind of the whole system?
Short answer is yes. HISAC, AHA, VHHA, FBI TACU, CISA, JCDC, lots of forums to have conversations at various levels. When it comes to security incidents, I really don't hide anything. There may be something that's client attorney privilege that we will protect. But generally, if there's something to learn from that incident that I can share with peers and peer organizations, we're doing it. there's something that I can share to the federal government so that they can advance their cases and do something, even if it's something other than law enforcement, I'm sharing it. And, you know, I've had that conversation with our general counsel already, with my boss, the CIO, and with our CEO. They understand the position. We will have the conversation before we do some sharing, but by and large, we're going to do that share because there's something to be learned about that. That's what I was pointing to earlier about partnerships. It's important to share what we can, so that others can learn from that, perhaps change their posture. Who knows? What I share might help one of my fellow CISOs have that conversation and carry that conversation over the line to get to a better posture. And likewise, you know, I've received a lot of information from my peer group, from other organizations about what they're doing and how they're handling risks and how they're handling conversations. And that's helped me have those conversations with our leadership and our operational folks so that we reach a better state, a state of tolerable risk that I feel is better than yesterday.
I'm in a couple signal chats where I learn a lot. That wouldn't have landed like that a couple of weeks ago. But no, I'm a certified ethical hacker, and you see me at things like Black Hat and DEF CON and B-sides, and so I still have the ability to understand when someone's detailing the cool hack that they just learned, you know, how to break into something, you know, Active Directory or Microsoft 365, do an MFA bypass. I still have the ability to really get it and try it out myself. Although, you know, a couple more years of this, I don't know how long I'm going to be able to keep it up, but that's the forum that I have historically loved to learn about that kind of stuff. Maybe I'm not going to get all the details about this big breach that happened, but I learn how it works, and I can make a judgment then. Is that going to be a big deal for us? Should we prioritize this over that because of this? You know, so I know a lot about some tools that a lot of people might not have heard of that I want to try and get into my organization so that we can, you know, plug those gaps.
Pro, Ghidra.
Yeah, well, I mean, but Bloodhound and Bloodhound Enterprise.
Yep.
That's I brought that into an organization, and they didn't really get why I did that. And as soon as I left, I was pushed out. So I could spend hours talking about the problems that helps you solve. So and why it's so critical. So as far as forums go, I'm still a techie, and I love those forums. But Signal is, you know, I've got Signal chats with CISOs, and you know, it seems like every couple of days I get a Chatham House rules, please, and then I get some detail that you won't see in any news article. So, and that's all Signal chat. No national security advisors have been added to my Signal chats yet.
My house hasn't been bombed, so I can confirm it.
Yeah.
Yeah, I'm also pretty much a geek at heart. And probably my favorite Signal chat group is the SCADA chat group. And this is acquiring firmware, taking it apart, fuzzing it, understanding, oh, there is a default password in here. And oh, there is a problem with this thing and that thing. So a lot of CISOs tend to be cut from the same cloth where they're that tech at heart and they really get it. They really understand it. But then being able to have that risk conversation with business leaders to help them understand, well, what is the true risk here? Yes, it's in the realm of possible. Yes, it's part of the art of possible, but what is the risk? You know, is this more likely than not? Is this going to shut my doors forever, or is this going to cause me to shut off an application for a few hours?
Yeah, I mean, if you're lucky enough to get $50,000, you got 45 places to invest that, right?
Yeah.
And the more you know about how some of these things work, you can rule out half of those. If you have enough detail. And someone might say, you're crazy. Why are you not investing in that? Well, I know a lot about how you can hack that versus this.
Right.
So yeah, it's every little bit helps. You can't know everything about this industry. You just do your best to learn as much as you can.
brought up hacking, I was curious if your opinions on like, like automated and testing tools, good supplemental tool, or see that being like so red team.
Yeah, no, I say automated pen testing tools are great to get you started,
Yeah.
but we need
Yeah.
humans doing that, thinking like humans do. And a lot of my pen tester friends are using AI to help them do their job better. But you need to interpret, like, you can't have AI doctors treat patients. Today, we have all these alerts, like, if you get something from an AI, you've got to look at it first before you incorporate any of that into your decision making. So pen testing's the same, but going back, I'll bash automated tools all day if they're executed at something and then those data are trusted without anyone setting eyes on it. That might as well not do it. You might get lucky. You might see some things that are problems, but the risk discussion has to enter. How can I use that to cause damage? That's the value of a person. That's when I brought up, Epic will go down for a week. That's not something a tool's can. That's something someone interpreting the data and the magnitude of that problem is going to be able to translate that into business speak. And pen testing without business speak is useless. Mike.
How does your leadership, how they have a certain way that they want you to either quantify or qualify this? How do they make, because Paul, you mentioned that before in terms of driving what the risk is to the organization. You guys have of describing that risk, and it's all risk described at the same time. How does that work?
That's actually a really tough question to answer. There isn't a prescriptive way to share risk. Yes, we do quantify and we qualify. We try to do that. What we try to do is ensure that we're doing good analysis and that our statements of risk comport to the analytic result, right? So we're trying to remove biases, looking for subjective biases. That's my main focus, because as soon as I start quantifying, and we do some quantifying, we'll grade a risk, high, low, or medium. The problem I have with that is everybody pays attention to the high and says, that can't be high, we got to do something. All ignore low and mostly ignore moderate. And that's not the conversation we need to be having. The conversation we need to be having is, these are the risk points that you need to consider. Here are some mitigating or compensating controls that you can apply. You figure out what your risk tolerance is, and then document that in your system security plan, because that's you. That's a you thing. It's not a me grading it and you don't like the grade, so I've got to change the way I assess risk. So the high, medium, low, I have a love-hate relationship. It's mostly hate.
I'd point to my team and say, do you agree with that answer? Because I think
One
that's
can
what
still-
I see.
Yeah. But NIST CSF is encouraging the adoption of risk tolerance statement. Have you tried that out?
I haven't tried that out yet. I do like that concept. And that gets us closer to where I'd like to see my information assurance team get to. And that is, I want you to make a statement about what you have observed and analyzed.
Yeah.
With a level of
Not
confidence.
just yellow, red.
Exactly. And in business terms. No cyber speak, no IT speak. That's hard. That's a hard bar to get to, but that's a bar I think we need to reach for.
And with an acknowledgement that we've got some departments that walk a little bit more on the wild side than others.
Sure.
So, they won't accept a high risk. They're pretty free with those moderates. And eventually, those add up.
They do. They do.
kind of, the flip side is, I used to run a AppSec pen testing service. That was one of the things in my team. And one of the senior VPs who reported to the CIO said, if that report comes back and there's anything on it, you need to go fix it. And I mean, honestly, we report low risk findings all day, and I would stand here and say, that's such a low risk, I wouldn't waste my time on it, but you
Right.
have to report
Right.
it.
Right.
And their senior VP was forcing them to. And I like that. I like the concept of doing that, but the realistic impact of that was probably an awful lot of wasted time.
I would agree with that. I think the step that was missing is management interpretation of the results and the decision on whether or not to apply resources to resolve it. Because quite frankly, that's where management can say, we get it, we understand this risk, and quite frankly, I don't care if it's high, low, or medium. We get it, we understand, there's a cost associated with this, there's a resource requirement here. We're not willing to obligate that at this time. Therefore, at this time, we're going to do nothing. That is a statement, that's legitimate. Management can say that. And that's okay. Of course, we'll document that. We'll ask whether or not there's a time frame in which this will be readdressed, right? So it's okay to do nothing sometime, right? But it's important to articulate why you're doing nothing. Saying, now the management statement that if there's any risk at all, we're going to fix it.
Have to
Do
prioritize.
you have the budget for that? If you have the budget for it, great. If you have the budget to fix everything, single risk that gets raised, wonderful. I don't actually know an organization other than maybe US government that can actually do that. And I know they don't fix everything either.
Are you going on record saying?
Yeah,
Don't
this is being
answer.
recorded, right?
Don't answer.
Is anyone from the Atlantic magazine here? Yeah. All right. If there are no more questions, we've got beverages around the corner, right?
Wonderful. Well, thank you all. Appreciate it.